I'd like to tell you just a little bit about my background and where I'm coming from so you understand a little bit about my perspective on dementia, which we're going to talk about today. I'm a social worker. I have been working in senior care for about 21 years now. I'm very passionate about working with older adults and their families. I'm particularly passionate about educating families and as well as professionals about dementia. How do we deal with dementia? Is dementia normal? What types of things do we need to know about dementia? Because dementia does not happen to everybody as they get older. Not only that, a lot of times people think that Alzheimer's disease is the only type of dementia that is out there, but there's actually many, many types of dementia. So I find this particular seminar to be very, very helpful to understand the different kinds. How do you treat them differently? Okay, so what is the normal aging brain? As we get older, there's lots of things that are happening to our brain, okay? Lots of things are happening to our brain. Every single organ in our body is changing. Anybody want to object to that? Okay, everything. Our vision changes, every single organ becomes less efficient, but this isn't bad. This is just aging. Does anybody have any idea about how old we are when our body, our organs, our systems start to age? Anybody? 30. 45. You know, 30's closer. Late 20s is when our bodies start to age. Now, this isn't something bad. This is just the way our bodies are aging. When we're born, we begin the process of growth. And then in our late 20s, our early 30s, we begin the process of aging. And again, it's not bad. Aging is what it is. Our organs are becoming a little less efficient. They're shrinking. But if we, in a lot of cases, we're going to live long, healthy lives as long as we take pretty good care of ourselves. Sometimes families will assume, oh gosh, well, she's just getting older. There's a lot of bad information out there right now about aging. Sometimes there's a lot of assumptions that are made that, oh, well, you get older, you just lose your memory. Everything starts falling apart. Anybody heard this or seen this or thought this or heard people make jokes about this? Yeah, it's sort of a common thing, but it's not true. And so when somebody has memory loss, short-term memory loss, confusion, poor judgment, personality changes, we want to take a look at them. We want to make sure, is any of these items, are any of these items causing the temporary dementia? Or is it not any of these, and we have to be concerned that it is a permanent dementia? Dementia is a collection of symptoms, and for the purpose of this conversation today, we're going to talk about dementia as being short-term memory loss, confusion, poor judgment, some personality shifts sometimes, getting lost in familiar places. So dementia, of course, is an umbrella term. Dementia in and of itself really shouldn't be a diagnosis. But as a social worker, I go into hospitals, I go into nursing homes, and I see a diagnosis of just dementia. And it's really not the best diagnosis for somebody because it's really just a collection of symptoms. It is important to understand that you can have dementia symptoms that are temporary and reversible. But then, of course, you can have dementia symptoms which are permanent and irreversible. Treatment options sometimes are different. Sometimes the duration of the illness is different. And when you're a caregiver, don't you want to know if the average length of this type of dementia is 5 years versus 15 years versus 1 year? That's pretty important stuff to understand. Also, planning for advanced directives, wills. How long does my money have to last in order to take care of this person? Family history and genetics, that probably is one of the most common questions that I get when I work with families, and I bet the professionals here in the room will second that. We hear a lot of folks say, you know, if my mom has Alzheimer's disease, well, I'm definitely going to get it. And that's actually not true. 70% of all the permanent dementias are Alzheimer's disease. I always use the fast food analogy. So when you think fast food, which company do you think of first? McDonald's. Everybody thinks of McDonald's first. Alzheimer's disease is your McDonald's. It's the one that when there's permanent dementia, you're going to see that more than the others. About 17% of permanent dementia is vascular dementia, and then the less common ones fall into the 13%. That is Parkinson's, Lewy body, Pick's disease, Creutzfeldt-Jakob disease, Huntington's disease. Again, we're going to see these a lot less frequently. it really is a use it or lose it proposition when you have a permanent dementia. Communication. One of the things that's urgently important is to remember that everybody with a permanent dementia is having diminished communication skills, which means that they have a lessened ability to understand you, and they have a lessened ability to communicate with you. We have to be really conscious of our nonverbal, okay, particularly our facial expressions, the tone of our voice, the way that the inflection that we're using, the volume of our voice. I think sometimes we see families that they're trying so hard to get through to their loved one with Alzheimer's disease or another permanent dementia, and they start speaking louder, thinking, gosh, maybe that'll get through. But it's really important to kind of keep your tone as even as possible. All of the permanent dementias, every permanent dementia we're discussing today is permanent and terminal. So every single permanent, as of right now, okay, and I'm an optimist, I'm hopeful that that won't always be the case, but as of right now, we don't have any cures for any of the dementias, and people do die from the permanent dementias, all of them. Thank you all so much. I really appreciate you coming. I hope you have a wonderful weekend.